COVID experience told us a lot about the recovery community, didn't it? Because actually the residential bit had to go into lockdown just like everyone else did, and we had, unbelievably, 18 people with some staff coming under with all sorts of difficult testing arrangements, but they were just locked down, just like anyone else was in their home. And yet somehow in all of that, and I know this story, they also became a part of a project that you got involved in feeding more vulnerable people than themselves in the community, and this notion of giving back. So just tell us a little bit about that and how it worked and what it did for people, because I think that encapsulates a lot of what we're about, I think.
I mean, with COVID, we were well prepared for it. It's without getting too political, it's one of the things that I don't buy about we got caught out and blah, blah, blah. We were tracking it from January. We'd seen it coming across mainland Europe. We saw that. We were really aware of it. We particularly saw what was going on out in Italy. And we just kind of knew that a lot of our guys were, I mean, we know that if you go through a long-term period of addiction, your health is just ruined. So we kind of knew a lot of our guys were susceptible. So we kind of we got prepared for it. We were stocked up. We kind of went into like a bit of doomsday prepping sort of scenario. Everyone was taking a piss for a few weeks before, but when the lockdowns kicked off, we thought we had this boxed off. But then we started getting phone calls or requests for support for people for stuff like electric, gas, for food, for basically people who were still active addicts within the local community, who basically, had to stay indoors and when normally their own addict lifestyle doesn't kind of work that way. So at first we had to turn them away for the first couple of days because we struggle at times with money. We've never got a lot of money to start with. Our money goes on, like I say, our money goes on recovery. We don't spend it on active addiction. There's enough people out there. However, we were getting phone calls about the same person from 2 or 3 places, and somebody basically just say, if you guys can't help, we can't do anything. So basically, myself and Sarah Flynn, and I think probably about 4 or 5 of the sort of trustees, and some of the guys who've gone on and done well for themselves. Basically, we sort of like a crowdfunding page, and we raised like 2 or 3 grand between us over a couple of days. And the idea was just to meet this immediate need, thinking that would be it. But we saw sort of like within like 4 days, 3 or 4 days, that it was our community just couldn't cope. This is our wider local community, and our residential place, our unit, Penrhyn House, backs up onto the Marchog estate, which is classed as one of the 10 most deprived areas in Wales. So it's got a lot of issues with food poverty, social deprivation, unemployment, addiction, etc. But we could see that just, there was a huge number of people within that community that were struggling from day one. And these weren't just addicts, these were people with mental health conditions, the elderly, people with physical disabilities, etc., etc. So we called basically like a crisis meeting with all the people that were referring to us. There was a couple of local councillors, a couple of people from like housing wardens and stuff, and basically just said, listen, get us a list together of all the people who need feeding, and there's a bit, and it just started from there. So we just started off originally. It was like a packed lunch scheme, sort of like, for a couple of days, food every other day sort of thing. But then, like I say, we just kind of, when you look at it now, it's mad even with the short period of time that's changed, but to think how scary things were at the time and how long it took the government, Welsh government, Gwynedd Council to react, to provide food boxes, food schemes for the most vulnerable in the community. We're probably talking a minimum 4 to 6 weeks, and in the meantime, it was us that stepped in to fill that gap, and without us, people, it sounds dramatic, but people would have starved, and that's how it was. And people sat in houses with no gas, no electric, no food, and there was nowhere to go to get money because everything was shut. And like I said, I think people forget how like Armageddon it was, that sort of first sort of 4 weeks, when everybody realised that nobody had ever been through anything like that, nobody had lived through anything like that before, had they? So. And then basically
talk about a prime example of asset-based community development. I mean, there it is.
Yeah, and basically you've got a lot of probably half a dozen ex-alcoholics and ex-drug addict chefs all locked in a house together with a big massive allotment outside, and we just linked in very quickly with all the supermarkets, and we were just pulling in like a load of surplus food, because obviously there was shopping was all over the place, and just making meals, freezing them, and then delivering them out, and then it just mushroomed and mushroomed. And I think at its peak we were feeding, I think it was about 120 families and individuals throughout Gwynedd and Anglesey per week. On the sort of, and that was 3 times a week to start with, and then we had to go into these weekly box sort of schemes. And I think the last count we did, we'd done something like 80,000 meals, and Christ, about 1,000 tons of dried food that we've got out, and that's kind of what's formed the skeleton project, or for the Surplus Food Club at Bwyd Da, because inevitably after feeding people for 2 years, and that's how long we were into it for, we still are to a certain extent. We still run like a food box scheme, a very limited number for families that basically get referred to us through intensive families first support, social services, health visit sort of stuff. So people in really dire straits. But the rest of the guys, we set up this Surplus Food Club in Bwyd Da, which kind of works. It's not like a food bank, but the guys pay like £5 a week and they get to come along, and it's a shopping experience. So rather than just turn up and getting 2 bags of stuff, you turn up and the whole stuff and everything's out, and you get the choices and pick for this, that and the other. But we've got a couple of the housing associations and a couple of private businesses. Big thanks to Hogan Road Construction, while we're at it, who funded like 25 memberships for families. So we've got some people access the scheme because they want to reduce waste food down, good for the environment, reduce food miles, etc., etc. Some people are in it because they're on the bones of their arse, and we've got some families who are accessing 2 memberships a week, so they're getting like 60, 70 quid worth of food for a tenner. Do you know what I mean? And again, what we've been able to do is transition those guys who were getting that weekly food box scheme across onto that. And again, that was the big thing about that worked. The thing that made it all work was the Welsh government actually realised we can't do this. We can't do it. Our procurement system and everything, and these too many levels, we can't do it. What actually worked was they just gave us the cash after a bit when they worked out what was going on. They just paid us directly, and that all worked. It worked fantastically. And now, I think with that pandemic, everything has to go back through that. And
yeah, just bonkers, isn't it?